Lastly, we've scheduled a question and answer session following the materials presentation, and we'll use that time to answer questions, that come up. If you have questions that come up during the presentation, please make sure to utilize the chat function as part of this platform. In the background, we'll be recording the questions that you submit via the chat function, and we'll come back to those at the end of the session. So with those items out of the way, I'd like to thank you again for joining us today. My name is Chandler Mintier, and I'm the Quality and Design Administrator, or a Quality and Design Administrator with the Office of Quality and Design. I'll be joined today by Emily Goff, and Emily is the new Limited Supports Waiver Manager for DSPD. So let's go ahead and get started. So the content areas that we'll go over today will include the Limited Supports Program. We'll go over DHS Procurement Number 90858. That is the procurement that's department-wide, and we'll circle back to that. That drives predominantly the services behind the Limited Supports Program. We'll also go over the service offerings out of Procurement Number 90858. And we'll also go over some other waiver services that are available to individuals who access the waiver. Additionally, I'll go over information on applying for the procurement and going over a little bit what the procurement entails, as well as previously mentioned, the question and answer session at the end of today's call. Something to keep in mind today during this call is that as this is a DHS-wide procurement, the services that we'll discuss today are available across the DHS service spectrum. And we've invited all DHS contractors to this call. To put that another way, the services that we've designed and implemented as part of this procurement may be accessed by individuals served in the other entities in DHS, be it Child and Family Services, Juvenile Justice Services, and the other divisions supporting DHS service recipients. So balancing such an effort with a broad array of contractors presents some unique challenges in information delivery. So today, some of the information shared may not be new to those who have experience with similar services, but trying to bridge that gap across the spectrum. At the end of the presentation today, Emily and I will be sharing our contact information, and we both encourage you to reach out should you have any questions in the future. You may also rely on the same contact information should you seek technical assistance as you review the procurement, if you have any questions, and certainly once it comes time for service delivery under that procurement. So with those things out of the way and with that done, I will turn the time over to Emily to provide an overview of the Limited Supports Program and waiver. So, Emily, please take it away.
Hey guys, I'm Emily. So we'll be going over today the Limited Supports Waiver, a brief overview, and then like Chandler said, if you have more specific questions, please ask us at the end. So overall, the Limited Supports Waiver is a home and community-based waiver. This program is kind of different from the typical waivers that most people are familiar with DSPD. This waiver targets participants with low support needs, and then in those within that population that does not have high support needs, we are selecting the people that have been waiting on our DSPD waiting list the longest. Each participant that comes in this program gets an annual budget of $16,400. It renews each year. We also have increased budget flexibility with this budget. So participants get this money loaded into their plan, and they really get to dictate how they use those services within their array of services offered. And then the support coordinator can help really promote individuals designing their own service plan. We have some new services that are unique to this program, like remote support options that we are developing right now, whether that includes something like a one-on-one support just remotely, or we are working with contractors nationally for different remote supports that look at things like monitoring inside a person's home and really being able to help them live independently. The current step of this program, this week, DSPD and the Utah Department of Health have finalized this waiver language. The next steps will be, we are posting it for public comment this weekend. That will be out for 30 days. At the end of that, we will review our comments and revise our waiver application, and then we will be submitting it to CMS. CMS has 90 days to review it and get back to us. Right, Chairman?
Awesome. Thank you, Emily. In our next section, we're going to go over DHS procurement number 90858. We're going to start with some description and the current status of the procurement, and we're going to move into some of the more specific service offerings included within the program. So to begin, the large majority of individuals accessing services under procurement number 90858 are likely to be individuals in the Division of Services for People with Disabilities, which I'll refer to from here on out as DSPD. They're likely to be individuals in the DSPD system, as the DSPD system was the large driver behind this effort. But again, just as a reminder, since 90858 is a DHS-wide contract, these services offered may be accessed by individuals served across the DHS service spectrum. The development of the Limited Supports program has worked through some start-stop challenges posed by many factors, including COVID-19 and the public health emergency behind it. However, as DHS desires to support individuals and families, regardless of challenges posed, DHS has endeavored to offer limited support services utilizing existing state funds while the waiver is under review by state and federal officials, as Emily has pointed out. And just another plug on Emily's slide, as this waiver is available for public comments currently or will be in the next 30 days, that public comment period will be 30 days long. So if you're interested in learning more or understanding about the waiver, or if you have questions or comments you would like to make, I would encourage you to access the Utah Department of Health website in their waiver section to participate in that, the public input sessions, again, that will last 30 days. Now, because of the unique start-stop challenges behind this, this is being run in a kind of a unique way, as Emily has pointed out. Right now, we're offering, in DSPD services, we're offering access to this program by utilizing existing state funds. This procurement is available to other DHS service populations right now, without respect to the waiver. It's available now. So what does it mean if we're doing state funds only prior to the waiver being approved and implemented? So from a contractor perspective, this doesn't really change much. A way to put it would be that the contract stipulates to the contractor the expectations from the Department of Human Services, just as is our relationship right now. However, from a waiver perspective down to a state, the waiver is what gives the state the rules that we must follow in our contracts, which then get implemented in the waiver. We'll go over in a little bit more detail what this means moving forward in the next slide. Okay. Thank you, Emily. Again, 90858 is currently available for application, and I've included the link here to that procurement. If any attendees on this call are not familiar with the DHS purchasing website, I would encourage you to take a look, as the site includes many contracting opportunities to support families and individuals in DHS services. In order to access the DHS procurement site, the link you have above will have a home link that you could follow, or simply by eliminating DHS 90858 from that web link, it will take you to the DHS procurement slides, or excuse me, website. As mentioned in the previous slide, the limited supports waiver is in the process of being reviewed and approved by state and federal officials. Right now, it's in the public comment section. The result of this may be that DHS receives feedback, which may require us to review and potentially adjust some service descriptions for those services that we will discuss today. Should that be the case, DHS will be engaging with our individuals, our families, other state agencies and federal agencies, as well as our service providers to further refine the service specifics. As is the case with all DHS services, we are consistently interested in your feedback, critiques, or positive that can help us design better services to support the individuals that you support within your agency. The ultimate outcome being support to keep families together, support independence, and give the individuals that we support the lives that they want to live. Next slide, please. In service offerings, we're going to go over the specific service offerings in procurement number 90858. In addition to this, we'll also be going over some services that can be accessed by individuals who do end up getting served on the limited supports waiver. So let's jump into that. These are the services available under 90858. In the coming slides, we're going to focus on some of the specifics offered in these services. The nature of some of these services is going to be familiar to you, and others are going to be entirely new services. As Emily pointed out, remote supports is an example of that. We're going to be going over these services at a reasonably high level, just with respect to the time that we have today. So if you have any questions regarding the services, please review the procurement or reach out to Emily and I. And of course, as a reminder, you may also utilize the chat function for any questions that may come up during this, during the delivery of this information, utilizing the chat function, and we will circle back and attempt to answer as many questions of those as possible. So let's jump into some of the unique services provided on 90858. Starting with employment services. Employment services provide the opportunity to support individuals seeking to obtain or maintain competitive integrated employment. So what is competitive integrated employment? In a nutshell, it is employment that offers wages comparable to others at the work site performing similar work. It is employment that is fully integrated into the community and working with individuals of all levels and ability. And employment offers the same opportunities for advancement and benefits as others employed at the same business. Now, if I could just circle back to my first point on that about employment offering wages that are comparable to others. A stipulation within that is that the wages are at or exceed the minimum wage requirements per state law. Individuals interested in a more full definition of competitive integrated employment may review the 9058 procurement, specifically the definition section of that to help you understand more in depth about what that is. So into some of the specific service codes. Individual Supported Employment, or ISC, provides ongoing job coaching and supports to assist persons with obtaining and or maintaining competitive integrated employment or self-employment. This is similar to services offered throughout the department with some unique tweaks behind it, and I encourage you to look at the procurement for those details or reach out to Emily and I in the future. Our next service offering is Integrated Community Learning, or ICL. ICL provides supports to strengthen social connections and personal relationships. It provides training and opportunities to build and explore interests, and it helps develop the necessary skills for future competitive integrated employment. This service can be provided in a small group, up to 3, or it can be a one-to-one service for individuals. Some of the optimal outcomes of ICL include community integration, competitive integrated employment, and development of natural supports and skills that enable the person to fully participate as a valued member of their community. Next, we have pre-vocational skill building, or PSB. PSB provides employment skill building and opportunities for job exploration. Exploration may assist persons served by helping experience and understand competitive integrated employment opportunities that match their current or desired knowledge, skills, and ability. And this is a service code which can help identify an industry or a particular job that a person wants to work in, further assisting with the development of the skills to obtain that competitive integrated employment. It could be unique to a particular industry, or it could work on general skills of employability for the individual supported. Our next service is the Job Development Supports, or JDS. JDS provides experiences and opportunities for persons seeking to advance in their current employment. So you see the little bit of the shift in the pre-vocational to this job development. Now, what does it mean to advance in current employment? Some examples of that may include more hours worked. It could include support to advocate for a higher wage for the individual employed. And it can also help with experiencing new workplace opportunities. Hired by an agency, understanding that the beginning of your job scope may be limited, but this support is intended to help the person advocate for themselves and with their employer when they're ready to go beyond what the original scope of their work is, experiencing new workplace opportunities and the opportunity to train and advance a skill set to be able to master those new opportunities. These employment supports represent a continuum of DHS services and are likely to be paired with other existing employment supports, such as the Utah State Office of Rehabilitation, the Division of Vocational Rehabilitation. This service continuum may appear to have some duplication of supports between service codes, meaning two service codes may have elements that are similar to work towards the same end. But while it may appear that some supports are duplicated between service codes, this is intentional to support individuals to meet them where they are in their employment path. Certainly, there are a lot of unique factors in an individual's employment status, so flexibility in service delivery is paramount in supporting this effort in employment for the individuals that we support. Next slide, please. Behavior services. Behavior services have the goal of teaching and developing skills that assist the person in their surroundings, reducing adverse behaviors, and provide positive replacement behaviors that support stability, productivity, and independence. Similar to the early and periodic screening, diagnostic, and treatment, or EPSDT benefits on the Medicaid state plan, these services break out into two categories. We have the behavior service, or BAP, and we have the behavior support professional service, or BTR. The BAP service code requires the individual employee to be a licensed board-certified behavior analyst. The BAP employee assesses, reassesses, and builds behavior support plans to support the person and their family, and may include family training on the behavior support plan. The BTR service code requires the individual employee to be a registered behavior technician. The BTR employee implements the behavior plan and provides services under the supervision of the board-certified behavior analyst. Next, please. And Emily mentioned these services briefly in a previous slide, but spending some more time on them. Remote services, they leverage current and emerging technologies to provide remote assistance and monitoring of persons in their residence to support independence. These services may range from two-way audio-video exchanges between paid staff and the person, all the way down to remote sensor monitoring and personal alert pendants. This service is broken into two categories. The Remote Supports Initial, or RSI, supports the cost of installation and purchase or lease of a remote monitoring system itself. Whereas Remote Supports Monthly, or RSM, represents the service code to convey billings for the monthly costs of maintaining such technologies. Now, as an emerging service category across the nation, and I am happy to say that the Department of Human Services in Utah is well ahead of the curve in this emerging service area nationally, we do recognize that new technologies are consistently being developed and introduced to support individuals living in their own homes. As that technology advances, DHS will be keeping an eye on the technology, and we may be in a position to adjust the service description to capture new and exciting opportunities to support individuals in their independence, relying upon technology to reduce the reliance on paid staff and to support the individuals receiving services to lead the lives that they would like to live. Next slide, please. Peer support services. This is new to the DSPD service system. Certain elements of this do exist elsewhere in the Department of Human Services. But just as a refresher, the peer support services is a mentoring service to connect individuals with lived experience, be it family-to-family connections or person-to-person connections. The service is designed to help facilitate these connections through a trained peer to help link persons, families, and non-professional caregivers with local resources and supports, to provide advocacy, including developing advocacy skills for persons and families, assist persons and families in navigating social and educational services, which may include person-centered support plans and individual education plans, to support persons and families to effectively self-advocate, elevate their voice, and to really support them in gaining the skills to take a leadership role in the choices and services that they would like to make for themselves. Now, advocacy is intended to represent all facets of a person's life. While examples may include, like I previously mentioned, education systems or planning or social service systems, advocacy is not limited to those areas. Advocacy, I won't try to define that here, but the service is intended to help support the individual to advocate for themselves, the skills that they need to express their concerns, their wants, their desires, their goals, and the services that they would like to see in their lives to get there. So with that, I will turn the time back over to Emily to review other service opportunities to persons served under Limited Supports Waiver. Emily?
All right, thanks, Chandler. So some other services that are unique to this program and new to DSPD, one is individual goods and services purchases. Of that person's, like we said before, they have a spending cap of $16,400 per plan cycle. Up to $2,000 of that money can be spent on individual goods and service purchases. Most likely, we have things like this will come from an Amazon contract that DSPD has. The purpose of these purchases for the individual is to help build independence and decrease the need for other support services. So these can be things like assistive technology and other things that can really assist the person in building independence so they do not have to rely on other staff or supportive services. This program also includes adaptive equipment like some of our other waiver programs, whether that be home or vehicle modifications, things like ramps or lifts or things that would help the person in their home. We also have some unique transportation codes. We're going to be utilizing our UTA contracts as well as some potential things like ride sharing through that individual goods and services category. Another new service that is unique to this waiver that we are really excited for is developmental behavioral interventions. Chandler covered some of the other additional behavior services. Like he said, these services will be available to a person if they're eligible for state plan services with an autism diagnosis, They will be eligible for these services once they age out of that program. He mentioned in some of our other waivers, we have that behavior consultation piece. With this program, we will also be able to utilize that registered behavior technician level to help implement a behavior plan. It also includes new intervention types like floor time, DIR, TEACH, Early Start Denver model, and some other developmental relationship-based interventions. That will also include the professional level and then a paraprofessional level for implementing those services. Let's see. Oh, I'm going to actually go back, and I'm going to cover a little bit too more. Chandler talked about some of the remote supports. Like he said, you know, DHS is really excited to be creating some of these new services. We are looking at Ohio, who is a leader in remote supports. So we talked about some of those equipment. We also, with the attendant care service in this waiver, are allowing people to utilize that service through remote supports. Here's our contact information. Again, my name is Emily Goff. I'm the administrator over this program, and Chandler is working with Office of Quality and Design if you guys have questions after this.
Thank you, Emily, and I appreciate you stepping in on the remote supports and helping convey that. I apologize for missing that. To further explain, while the remote supports pay for the initial installation and the monthly upkeep of the equipment, be it software updates or physical changes that need to be made to the equipment, once an individual engages an active communication through that system, the contractor then bills at the attendant care service. Having not gone over the attendant care service in these slides, what I can tell you is attendant care service in a nutshell is a quarter-hour service. For those of you familiar with supported living, it is akin to supported living. The rate is approximately $27 an hour, I believe. But that service is utilized on a quarter-hour basis to help support independence, skill building, those things that an individual may need to help gain and maintain the independence, or at least the independence level that they desire in their lives. So thank you for allowing me the opportunity to do that, Emily. Next, we're going to begin our question and answer session. So again, please ensure that you use the chat function on this platform. If you are unfamiliar with how to get to the chat function, at the top right-hand side of your screen, you'll see what looks like a little idea bubble that has some lines in it. Please engage that button and you can type in your question. We'll try our best to get to all the questions as time permits, which seems to be a good amount of time. But please note that we may not have all the answers to your questions, and we may have to get back to you regarding some of the answers. So I'm not seeing any questions that have been posed yet. Oh, here's one from, the question is support coordination involved in the LSW? Emily, I'm going to send that question over to you.
Yeah, so support coordination is involved, included in this program. We are starting support coordination in-house with DSPD. Right now we have one coordinator hired, Jody Hansen, that is on this call. So initially, why this program is still small, we will keep coordination in-house. We anticipate this program to grow bigger. Hopefully, if we get some more money at that point in time, we may consider pushing support coordination to external contracts.
Thank you, Emily. Our next question, Emily, and this one comes to you as well. Could you review who may be eligible for these services? And is this primarily for those on the waiting list with DSPD?
Yeah, so I touched on it briefly, but yeah, I can get into more specifics. So as you guys are all aware, probably DSPD has a very long waiting list. Typically, when we get appropriation money from legislation each year, we pull people off the wait list that have most critical needs that get to that top of the wait list. This program is really focusing kind of on the opposite side of our wait list, people that don't have high critical needs, people that just maybe need a little bit of help to maintain independence, whether they live on their own or with their own families. So we look at their needs assessment questionnaire scoring that ranks somebody on our wait list. We look at a certain threshold for each individual age group. So we're looking at children, transition teen years, and adults. Within each three of those categories, we look at who has been waiting on our wait list the very longest, and those are the ones that are starting to come into this program. So it's pretty opposite of how we usually are bringing people into services. Again, they're usually individuals that have low support needs or a lot of natural support, so they do not typically rise to the top of our wait list, where usually the most critical needs are coming into services.
Thank you, Emily. The next question is regarding the attendant care portion for remote support. The question is that rate service utilized for active engagement remotely and when backup support is required in person? So as an emerging service area within DHS, there are going to be some experiential questions that we'll need to, in situations where we'll need to work out with our contractors. And that is the backup support. Certainly when an individual who utilizes the remote support function and is engaging in active services with a paid staff, then that is reimbursed utilizing the attendant care rate. And the attendant care rate also when that backup staff shows up in person. But we do recognize the newly unique to DHS services regarding that on-call staff and what that may look like. We look forward to engaging with our service partners as the Limited Supports Waiver grows to understand how and when we can implement such a program. Emily, the next question will be for you. When a person's receiving Limited Supports Waiver services, will they remain on the waiting list?
Yeah, so this program is designed, like I said, for those with lower support needs that can safely be served within that spending cap each plan cycle. So these individuals that are coming into this program will be pulled off the DSPD waiting list if we can ensure that their health and safety needs will be met within this program. At that point in time of coming off the wait list, the individual still can decide if they would like to wait for more comprehensive waivers on our wait list. They do have the option to stay on the wait list for those other comprehensive waivers if they were to be pulled off with annual funding.
Fantastic. Thank you, Emily. And it looks like we do have one more question, Emily, for you. What service would work for individuals who just need executive functioning skills like dealing with mail or paying bills, etc., or possible upkeep, keeping environments clean?
Yeah, so most likely the most used service for that type of scenario would be attendant care. Like I said, that attendant care can be done in person or remotely. So if it's if that individual needs help with something that is not hands-on, for example, like potentially paying bills or getting through a recipe or checking in with them to make sure they're taking their medications and kind of doing their daily routines, that can be done with a quick check-in for in a remote situation. But most likely that service would be attendant care, like I said, in person or remotely, to just kind of help that person, that one-on-one quarter-hour service with those type of skills.
Thank you. And I would just like to take a moment. I want to circle back to the question regarding the remote supports and the backup staff. I think one of the areas that I missed there was, while the RSI service code helps support the installation or purchase and leasing cost of the equipment, the remote support's monthly rate is intended to reimburse the contractor for the cost incurred to monitor the service, right? So there's someone in the background who is ready and ready to engage with that individual should an active connection be made. So I apologize for my limited response on that. Thinking from a service provider, for example, in Utah, who may need to receive a call to show up to the person's home. But from that remote supports company, the RSM service code is designed to help cover the cost, not help, but to indeed cover the cost of monitoring that system passively. For example, an alert pendant only works if when someone pushes it, there's someone on the other end to answer the call. So certainly within the RSM service code, that is the service that pays for the person to be there and be ready to help support that individual should they actively engage the remote system. But once that individual engages with that individual, helping with tasks or concerning situations, whatever it may be, then it turns into a more direct support where the billing would switch to the attendant care service, reimbursing at that direct service person rate. So I appreciate the opportunity to clarify that. Let's see. Our next question, what if a client has a full-time job, needs limited supports, but makes just over the Medicaid eligibility? Emily, I'm going to send that question over to you as it pertains to eligibility.
Yeah, I might not be able to answer this question fully, and we can get back to you. Part of, like what I said, this waiver is intended for individuals kind of like this question that are fairly independent, but just need a little bit of support. And again, we need to ensure that they can safely be served on this waiver. A part of that is that support coordination that we're really helping the individual utilize other community resources. So far, some of the individuals that we've already been serving, Jody has helped. We're looking at some resources like an ABLE account where a person can put in some savings money that will not put them over the Medicaid asset limit. We do, like Chandler said in the beginning, right now we are utilizing state funds as this is not a waiver program yet. So if an individual did have something that prevented them from being eligible for Medicaid, we could also look at potentially using some state funds, as however they would not be able to utilize all the money that is available for those that get the national match from Medicaid.
And if I could just step in with a quick plug, we do not want individuals' employment status to be negatively impactful to their ability to access these services. So to Emily's point, we have a number of service experts and resources available to help individuals or families who may find themselves in this situation where an individual may be very successful with work, and whose income may provide some barriers to accessing the program. Some of those things that Emily had mentioned will help in that. What I want to get to is that if you know of somebody or if you're supporting someone right now that may find themselves in that situation, please do not think of that as a barrier to obtaining services. We would like to support you to work through that with the individual and their family in order to, again, give individuals the lives that they want to live and try to overcome those barriers as best we can. Emily mentioned ABLE accounts, and there's certainly a number of Utah State Office of Rehabilitation opportunities and programs that are available that can help support an individual solve those income-related issues regarding their access to Medicaid and the Department of Human Services service array.
And one more thing I just thought of is to, depending on how much their income would go over that limit, again, there's some resources that we've helped individuals so that does not prevent them from being eligible for services. If it's not too much money, they can also do a spend down if they have medical bills or other things like that that would count to bring their assets down to the appropriate limit.
I'm not seeing any more questions, and I'm hesitant to do the awkward pause while maybe a few come in. but I also want to make sure I give everybody an opportunity to ask questions. So I think we'll just stay on the line for a few more minutes and try to answer questions as they come in. If we go too long, I know everybody on this call is incredibly busy supporting individuals to lead the lives that they want to live. If I haven't said that enough already today. So we may just end up ending a little bit early, but I'd like to give just maybe 1 or 2 minutes to sit in silence and hope that additional questions come in. So we'll go ahead and start that now, and we'll keep an eye on the chat function for questions. We have a question. Emily, I'm going to kick this one over to you. If income is a barrier, who do we refer individuals to?
Yeah, I mean, I'm not quite sure if we're talking about someone that has been selected for this program or, you know, other programs, but they're more than happy to reach out to me and I can assist that person.
And again, circling back to some of those things that Emily said on this same topic, if you're working with an individual or know a family or individual who may find themselves in this situation, reviewing ABLE accounts is a great opportunity. It's ABLE. Information for that is on the Department of Workforce Services webpage. Also, individuals that may have a large lump sum of money for whatever reason that may be, individuals can also access a special needs trust, ensuring that they maintain the money that they've made, earned, or have obtained in a way that still maintains Medicaid eligibility, but that money is still accessible to the individuals within certain rules, of course, to help support things like rent, housing, food, and other topics. So this isn't the individual giving their money away, rather it puts it in a unique account that helps individuals maintain their money and continue to access that money in accordance with the Medicaid spin down rules and financial rules behind the program. Thank you, Jody, the brand new support coordinator that Emily had mentioned previously. Welcome aboard to DHS, Jody. Has added a web link to the chat function also, ablenrc.org. Has some resources that may be helpful. So I think that brings us to the end of our presentation today. Again, Emily, would you mind going back to our contact information screen? Again, moving forward, we would encourage you to access the DHS purchasing website, familiarizing yourselves with some of the details within procurement number 90858. Again, seeing the other services that are offered through that website to support DHS participants. That can be a resource for you, but also certainly on the screen in front of you is Emily's contact information and my contact information. I cannot promise you that Emily and I have all the answers, despite how much I want to convince myself that I do, but we certainly, if we don't have the answers, we can certainly help make connections and facilitate communications between the individuals we're working with and those individuals that may have the unique and specific answers for the individuals that you are trying to support. So thank you all for your time today. I appreciate everything that you do. Thank you for supporting our great state, our great department, and for supporting some of the most vulnerable individuals that we serve in this state. Frequently, your job can sometimes be thankless, but on the behalf of the Department of Human Services, thank you for everything you do. Thank you for your commitment to quality, and thank you for helping the individuals that need your help to live the lives that they want to live. I would have winked if I'm capable of doing that, but I'm not. So Thank you all for your time today. I appreciate it. That brings us to the end of our session. Have a wonderful day and a wonderful weekend. And we look forward to communicating with you as the waiver progresses and as we may find ourselves in a position to adjust the service description. Thank you for everything, and please enjoy the rest of your day.
Thanks all. Bye.